Thank you. Students could soon be allowed to return to school right here in San Diego County. Dr. Jamie Friedman joining us now to explain what parents should consider before sending their kids back because they still need to make a choice. Dr. Friedman, good morning.
Good morning. Thanks for having me.
As a parent, going through a lot of what parents, other ones are going through, and a lot of them send me a message and say, Charlie, what are you doing? What are you doing? And I'll be honest, it's really hard. I don't know what to do sometimes. It's very confusing.
It is confusing. I mean, it would be nice if there were some really clear set guidelines or a lot of experience with this virus, but we just don't have that at the moment. And I just want parents to know that whatever decision they make for their family, that's the right decision at that time. So hopefully people can get rid of some of their parent guilt when it comes to making this decision.
I'm glad you said that because every family needs to make a decision based on the circumstances in their family. Dr. Friedman, I was just at Rady Children's Hospital a few days ago interviewing Dr. John Bradley. He's the medical director of infectious diseases over there. He's also on the board to help San Diego County schools reopen, unified schools reopen. And one of the things that he said to me, which we've been airing what he's been saying throughout the week, is that when a child goes back to school, they now can bring that virus back. And you guys are finding that many of these kids that are going into the school and they do test positive for COVID are asymptomatic. So you have no symptoms and they're carrying the virus.
Well, yeah, most of them are asymptomatic and or mildly symptomatic, and some do get sick. I mean, I don't want parents to think this is a free pass necessarily. Kids certainly can get very sick, although it's much, much more rare than with adults. And that asymptomatic spread is what is concerning for families when they send their kids off into school to be around other people, and then they bring it home. They think everything's okay when they're well, but in fact, they could be spreading it to older people who might be more at risk, or other kids who might be more at risk too, who have other health conditions.
I'm going to use the example with my family. So we have 4 kids at home, and we rely on grandma and grandpa to help us right now. Mommy has to work, daddy has to work. So when I have to make a decision to send one child off to school, now I have that problem. What he made me think, well, what if one child brings that back in and then grandma and grandpa are helping us? You know what he told me, Dr. Friedman, is once my kid goes back to school, grandma and grandpa should not be touching, kissing, holding, hugging kids anymore, and you need to wear a mask. And that could be problematic for a lot of families where you live with grandma and grandpa.
Right. I mean, this is really hard. Parents' decisions really have to be focused on, is there someone at home who's high risk? Can you be home with them? Because if you can't, then you might not have a choice. You might have to send them. But if they have to be at home because you don't want to send them and you still have to work, who's watching them? Right. And so that becomes a dilemma, especially if it's grandparents, because for a lot of families, it is grandparents.
What do you do if you do need to send your child, and the plan that if they are exposed to COVID, what happens at that point with the schools and the kids?
Well, I think if we're at a point where parents still have a choice, I think they have to consider, again, is anyone at home high risk? What is the school doing to not make it zero, because that's impossible, but really reduce risk? So, the things that the AAP had mentioned months ago, are they having the desks separated? Are kids wearing masks? Are they changing, how they go through the hallway so there's less exposure? Are teachers wearing masks? I mean, there's so many things to consider as far as what we call mitigation strategies to reduce the risk of spread. And if parents feel like, okay, we're not super high risk, I feel comfortable with what the school is doing, maybe the child didn't do so well last year with distance learning, or they're suffering because they're not seeing their friends, or they get special services at school. There's so many considerations. So if parents put that all together and feel comfortable with school, that would be their decision.
And I'm finding that is that you need to look at the big picture. What is the risk of spread currently? What are those numbers looking like? What is the school doing? Do you have somebody at high risk? So it's not going to be the same for every single family, as they have to make that decision, what kind of risk they're comfortable taking. Dr. Friedman, before you go, and I've been meaning, I wanted to ask you about this. I know that there's a lot of concern about masks and smaller kids. that by them wearing it, they're actually spreading more germs because we all know that those little kids can't keep their hands off their face and they're moving things around. What is the consensus about masks and little kids?
Well, I mean, I think that if the school is going to require masks, the parents need to start now with practicing. And we're not talking about kids 2 and under, okay, because that's not considered safe. But practice, washing your hands, wearing your mask, having your little teddy bear wear a mask. You'd be surprised. I mean, I would say a lot of the younger kids that come into the office will do a good job keeping their masks on. Some of them a little bit better than their parents. But you're right. So if you're constantly touching your face, you're touching the outside of the mask where other people's germs may have landed, and then you're touching your face, and you're taking it off and putting it on and putting it on your chin and putting it under your nose, which is a big one, then there is a higher risk. And so for the younger kids, it really may not be worth it. But for the teachers, it would be worth it.
Before I let you go, your final advice for families who are making their decisions, they could or could not be sending their kids back to school in the coming weeks or months, what would you tell them?
Like I said, make the decision that's best for your family. What are your circumstances? What are your capabilities of doing home learning? How did your kid do with home learning last time? Some parents really feel like, it was just a lost year. Some kids are coming to the office literally crying because they just need to see their friends. So there's so many circumstances to consider. Certainly ask your pediatrician if you have a question. But I think it's important especially if most schools are going to be starting at home, that parents get prepared now. Have your place set up, have a schedule, make sure you have breaks in the day, have your healthy snacks ready to go, get them on a good sleep schedule now because you know that they're probably staying up pretty late because it's summer. So again, it's going to be different for every family, like you said. But one other thing, it's really 100% based on the community spread. So it's really up to the community to keep the spread under control so kids can go back to school.
Absolutely. If we keep it under control, then kids can go back a lot sooner because we still got to work. Dr. Friedman, thank you.
Yeah. Thank you.
She's like,